I haven't.
What
I
I'm
haven't
saying
hit
is
the
I
time
would
of his
read a
question, so I
contract
don't know,
before I
Mr.
sign
Chair.
it and before I pissed away $323 million of
Perkins,
Canadian
your question
taxpayer money.
took 40 seconds.
This Guy's Garage. Like and subscribe.
I'd like to welcome the Honourable Mark Holland, Minister of Health, as well as the officials accompanying him.
Thanks very much, Chair. Thank you, Minister, for being here. You know, we know very clearly that this Liberal government has had millions of dollars of wasteful spending, and that issue tonight is talking about this deal with Medicago. $323 million of Canadian taxpayer money was lost. And what was the plan to protect Canadian taxpayers in this contract with Medicago?
Well, to be clear, the amount that we're talking about today is $150 million, and that has to do with the doses secured. There's a separate question around ISED. I expect that Minister Champagne will have news on that and good news on that soon. But with respect to the contract that's in front of us right now, what was done to ensure responsibility was to enter into an advance purchase agreement where we were able to ensure the doses. And I would put the question to you, if you permit me to ask it, what would have you done if Medicago was the only viable option? What would have you done?
The time is mine, not yours. I appreciate that. And the time to ask questions is for me, not for you. The time is for you to attempt to answer them, which, again, we'll get to that. So what you're telling us is no protection for Canadians in this contract?
No, that's not what I'm saying. I'm saying there were absolutely assurances that in order to get the vaccines that we needed to be able to enter into an advance purchase agreement. That advance purchase agreement contemplated that not everyone would work out. And so there was going to be a cost. Now, I'm not clairvoyant. I expect that you aren't either. Nobody was at that moment in time. We could not know which of those 7 options would work out. So it was prudent to make an investment in each one to ensure that whatever one worked out was available to Canadians. And that's exactly what happened. And is exactly why we had such a successful vaccination program.
So, again, with respect to Medicago, what you're avoiding, Minister, is really that there were absolutely no protections for Canadians here. This Liberal government invested $173 million in Medicago to start with, and then paid them out $150 million more and received 0 vaccines in a contract that, if I'm not mistaken, Minister, was signed after the pharma tech giant Pfizer had already been approved for use in the United States.
What I'm saying is that at the moment in time in which advance purchase agreements were entered into, that Canada had a responsibility, I would argue, to make sure that the doses and the right vaccine would be available. And that if, as an example, Medicago turned out to be the only vaccine that worked, and by the way, there's no way that we could have known that that's not the case, then you wouldn't be sitting here in this committee asking the questions, because it would have been Medicago's vaccine that saved all of those lives. Instead, you're asking the questions today because there were other vaccines that were successful.
Because it's very clearly known that the tobacco company was a major investor in Medicago. Everybody knew that, and surely somebody at the Health Canada department must have known that Canada signed on to the Convention for Tobacco Control, and this would never be accepted on the international stage.
Sir, I've been called by Imperial Tobacco a anti-tobacco radical. I was the chair of the Heart and Stroke Foundation. I was on the Ontario Coalition for Action Against Tobacco. But what did not occur...
Minister, this has nothing to do with...
Sure, it has everything to do with it, because
absolutely nothing to do with the
minority
question.
position...
If you don't want to answer the questions, just feel free to say, I don't know the answer. It's okay.
Well, it doesn't appear you want the answer.
But unless nobody did their due diligence, or nobody cared, somebody must have known Canada signed on to the Convention for Tobacco Control.
Sir, the reason I gave the other context is I am no fan of tobacco companies. I have worked my entire life to ensure that tobacco
that's not true. You actually
reduced.
Allowed nicotine
but what I'm
pouches
saying
to be approved in Canada as well.
What I'm saying, well, I don't know whether or not you want me to answer the question. It appears you don't. But if you do want an answer, if you do want an answer to the question, my answer is this: that a minority position that did not advance the interests of either nicotine or tobacco in Medicago. Let me ask you the question:
It's not time for you to ask
would have you used? Sure, it is. Sure, it is. If you would have you used.
You can have your chance to ask some questions.
Well, I don't.
When you're sitting on the other side, you can have your chance.
I've been on the
opportunity
other side,
to sit there. Then you can ask.
Mr. Chair, I don't know. What do you want here?
Go ahead, Dr. Ellis. You have the floor.
Thank you very much, Chair. Very clearly, 2 million Canadians are visiting food banks, and your government lost another $323 million without any accountability. And the answer, really, I guess, is that you don't care.
Well, I would characterize it this way: that if we didn't take a bet on all 7, then we wouldn't have been able to save those 800,000 lives. I don't know what kind of price you put on 800,000 lives. I put a pretty high price on 800,000 lives. And the reality is we didn't have clairvoyance. I don't know what psychic abilities you had, but I didn't have, and neither did the department have psychic abilities to know which vaccine would work out. So we had to take a bet on all 7. And we knew when we took those advanced purchase agreements that not all of them would work out. And yes, that would cost some money, but that's what we did to make sure that we saved 800,000 lives. That's what we did to make sure that we avoided 1.9 million hospitalizations.
Thank you very much, Minister. And through you, Chair, I guess, we're clearly not getting answers from the Minister. Mitsubishi is the largest company in Japan, and Health Canada and your department entered into a contract with the largest company in Japan, and if not mistaken, the 45th largest company in the world, and you gave them another $323 million with no protection for Canadians. You also gave them the intellectual property, and you received no vaccines, and you lost 400 jobs in Quebec. Now tell me, is that value for money? Tell Canadians it's value for money.
What I think, if I could, Dr. Ellis, is to say that if Canada had not entered into any advanced purchase agreements for vaccines, you're right, we would have saved a little bit of money. But what it would have meant is that we didn't have vaccines for the Canadian population. It would have meant 800,000 people would have died. It would have meant tens of billions of dollars of lost economic activity. It would have meant millions more people in hospitals, with hospitals being shut and people dying from other preventable illnesses.
Thank you very much,
if we didn't make those investments, it would have been catastrophic.
Thank you very much.
Minister, you're painting these hypothetical worlds to justify a $323 million loss for the Canadian taxpayer. Before this contract was signed, either to develop the vaccine or to buy the massive amount of 76 million doses, the U.S. had already approved Pfizer. So this world that you say didn't exist because you didn't know whether or not a vaccine would exist actually existed months before that. It was already approved by the U.S.
That's simply not true. I mean, I don't have the timeline with me, but I could turn to
It was
Mr.
approved
Shepard.
in the summer. This was the contract.
If you're interested in the answer, I can refer to Mr. Shepard. If you're making a political point and don't want an answer,
if he has it as figures, tips, he can get it. If not, you can send it to the committee in writing.
It's simply not true. If you want the truth, then we can provide it. But what you've said is not factually true. It's not true in substance or in fact.
Well, the other thing that's not true, because have you read the contract?
Have I read it? Look.
Yes or no?
Have I read the contract?
Have you read the contract to buy the vaccines?
I have not read the full contract.
No, if you had, you'd know, unlike the government Liberal members, the $323 million that's been wasted and the $150 penalty payment you've paid is not a down payment. It's not insurance. It's not a mortgage. It's none of those things. There is no clause in that contract that required any money up front. It's a penalty payment for not meeting your commitments under the contract. Isn't that true?
No. I've described the nature of the advanced purchase agreements.
What clause does it say you have to pay a payment?
If you're interested in badgering me, you're succeeding. If you're interested in an answer, I return to Madam Jeffrey.
So the $150 million was the advance payment for the at-risk manufacture of those vaccines to guarantee Canadian access to doses from Medicago.
There's no advance payment clause in the contract. In fact, will you release the contract publicly? Because before public accounts, the president of Mitsubishi said he would release an unredacted copy of it publicly. Will you release it since the president was willing to release it?
I can respond to that. The contract has been released in its entirety, unredacted. The Public Accounts Committee and to the Auditor General.
Publicly. He said he would release it
releasing
publicly.
Contracts publicly would place Canada's ability to enter into contracts with any company in vast jeopardy. And of course, you know that, and that's the game
Well,
you're
it's the
playing.
same reason why you're not releasing the Stellantis
No, it's the game you're
contracts,
playing,
because
to try to create
You're
misinformation.
hiding the fact that what you're saying here is simply not true, that it doesn't require you to pay this. It's a penalty because you entered a contract that said you had to buy 76 million doses. So I'll ask you again, who owns the IP?
The question of the IP is an ongoing matter, and it's not the subject of this committee's discussion.
It is, because you're spending $323 million of Canadian taxpayer money, and the president of Mitsubishi, before public accounts, publicly said not only would he release the contract publicly, but he also said that the IP was owned by them, not by the government of Canada. So has Mitsubishi sold the IP?
I'm not going to respond to questions around IP today. Those matters are being dealt with by Minister Champagne. He will respond to them. But I will say to you that looking backwards with the knowledge that you have now of what worked and what didn't is a very curious way to approach this. And I certainly hope that no future government would be saddled with the kind of decision-making that you're inferring that we should have taken.
Yes, it's true. We would never sign a contract that doesn't make sure that $200 million of Canadian taxpayer money, then the Canadians don't own the IP. We would never sign a contract that says I'm going to have to pay $150 million in a penalty because I didn't receive a single vial of a vaccine. We would never sign a contract that allows the largest company in Japan to sell Canadian-financed IP to anyone in the world. That works. The level of incompetence of this government in signing these contracts, when ministers don't even read the contracts. You haven't read them. You weren't the minister of the time, but I would have thought that in preparation for this meeting, you would have read the contract.
Sir, the officials that operate, and one day I hope it doesn't happen, but one day if you are in government, the experts and the individuals that we rely upon to enter into these contracts do so at arm's length. We do not make a decision, as me as a minister, to tell how we enter into contracts.
I didn't say
and if you're suggesting that you would reach over and tell the bureaucracy how you would do contracts, I'm saying there would be no contracts and you would not have protected this country.
He got equal time.
I mean, I haven't hit the time of this question, so I don't know, Mr. Chair.
Before I sign it and before I pissed away $323 million of Canadian taxpayer money.
Your question took 40 seconds. You interrupted him after about 8, and he's not finished his answer. You don't have time to ask another question because you're out of time, but you have time to complete your answer, Minister. Go ahead.
Well, thank you. What I would say, Mr. Chair, let's actually think about what has just been said. The member has just suggested that were he in government, he would have extended beyond the powers of government to tell and dictate terms to bureaucrats about how they should enter into contracts. And of course they're going to make a point of order because they don't want to have me make this point.
Just a second, Minister. Yes.
I guess I'm requesting clarification that, that the time is related to the actual person asking the question. I would suggest to the chair that there's no convention to say that the minister has the ongoing ability to elaborate well beyond the time allotted per session to answer the question. And I would suggest to you, Chair, that it would be exceptionally beneficial that if the rounds were as prescribed time-wise.
Thank you, Dr. Ellis. Mr. Perkins asked his question with 1 minute and 19 seconds left in his turn. With 40 seconds left, he finished his question, which meant that the remaining 40 seconds of his turn was for Minister Holland, and he was interrupted incessantly during those 40 seconds. So Minister Holland can finish his answer, and then we're going to move on.
Point of order.
Go ahead.
The 5-minute allotment is my allotment to make questions or comments. It isn't a guarantee. I could use the whole 5 minutes on a speech. So, Chair, I believe you're wrong in that interpretation. That 5 minutes ends at 5 minutes, whether I'm speaking or whether the witness is speaking.
Thank you, Mr. Perkins. Paulus.
Next, Mr. Paulus, 5 minutes. Thank you. Thank you, Chair. Good evening, Minister, ladies and gentlemen. Initially, when those 7 companies were given contracts, you knew. Well, first of all, when Medicago was authorized, when the vaccine was authorized, and then afterwards we found out that the WHO refused, questions were asked. Now everybody was being avoidant and didn't want to answer the questions. And now we know that the government knew full well after signing the 2005 convention. Last week, Public Works officials confirmed that the government knew that there was a problem. And now, today we're talking about losing $323 million, and we're hearing that the government took a risk. Are you willing to admit today that this was a known risk, and you still went ahead with it?
All the advanced purchase agreements, every single one of them was a known risk. And we knew that not all 7 would pan out, first of all. Secondly, as I have previously indicated, on the February date of 2022, Medicago was in fact approved. And so the decision by WHO is separate and apart from the use in a Canadian context. But 100%, all 7 came with risk. And we had to do that because there's no way that we would get companies to agree to enter into advanced purchase agreements without placing money on the table to ensure that they had their investments covered.
Mais vous saviez pertinemment, c'est dit maintenant, qu'il y avait...
But you knew full well that there was a problem. You knew that Medicago was not going to get the WHO's approval, and that you knew about the framework agreement, and then $323 million spent, and today having a company that just walks away with no return on this investment. The Quebec government also had agreements and also had reimbursement clauses, and Mitsubishi did reimburse the Quebec government. So why didn't the federal government have that kind of agreement? Or if they are such agreements, why aren't you disclosing them?
Completely disagree that that we knew there was a problem. The fact of the matter is that, as I said, WHO and the decisions that it made was under the context of having all kinds of other vaccines that were available. The decision was completely separate and apart from the decision that was made in Canada, which was to approve the vaccine. It was in fact available. So the reality is that vaccine was available. The WHO decision did not affect that. And secondly, the WHO decision was in the context of all kinds of other vaccines that were already approved. So trying to simplify it that way is just simply not accurate.
On va rester avec vous. Le médicament...
All right. I'll stay with your reasoning. Canada approved the drug, and even if the WHO didn't agree, we could have used it in Canada. Several citizens didn't want to have the other Pfizer, Moderna vaccines because of the mRNA, but they would have wanted to have Medicagos. So why not then allow these vaccines to be available for Canadians who would have liked to have a different kind of vaccine other than the mRNA ones?
And you're right, there was mRNA hesitancy, but we had non-mRNA options that were already on the table. So, and actually, that's a success of the advanced purchase agreement. We did, because that way we not only had mRNA, but we had non-mRNA options. So at that point in time, Canada had the vaccines that it needed, and it meant that we didn't need to proceed with Medicago. And therefore, that was the right decision.
Mais je reviens à ma question du début.
Going back to my initial question, will you admit that you made a mistake coming to this agreement with Medicago, because there were other vaccines in development and you spent $323 million, which you invested into a company where you knew that the company said it was going to take a lot more time to develop, and it was far from certain it took 2 years. That was faster than expected. But do you agree that this was a useless risk?
Fundamentally, no. If I was the health minister at that time, I would have 100% made this decision. It was the right decision. We could not have known which of the 7 would have worked out. I'm deeply proud of not only the government, but officials of entering into these agreements and ensuring that Canada had them. Look, if I could go back in time and not sign a contract, sure, with the knowledge that I have now, but I didn't have that knowledge. No one had that knowledge. No one was clairvoyant. There was no Jojo the psychic to call.
Thank you, sir. Dernière question. Les contrats.
Last question. So when I was at Government Operations Committee, we looked at all of the audits for Pfizer, Moderna to get the prices. Minister Anand at the time said it's secret, secret, secret. In the U.S. and Israel and EU, you had the price of vaccines. We knew Americans were paying $7 a dose. In Canada, we did the calculations and we ended up with $25 a dose. How come today we still don't know how much a vaccine cost?
When we enter into contracts as a government, there are confidentiality agreements that are signed, and those confidentiality agreements, frankly, assure us that the companies will sign contracts with us. If we didn't do it, we would do no business with anybody. It is an absolute requirement of us doing business. So, but what is important is the Public Accounts Committee and the Auditor General received the full unredacted documents. And the Auditor General, if you want to give me a moment, I can read what she said in explaining exactly. The Auditor said, and I quote, "In such an environment, advance payment and obligations for minimum purchases were required. Further, Canada had very limited domestic capacity to produce vaccines and therefore was reliant on internet imported products. We found, although a non-competitive approach was taken, Public Services and Procurement Canada exercised due diligence on the 7 vaccine companies conducting assessments."
Point of order, Chair. Chair, point of order.
Go ahead, Dr. Ellis.
I do want to significantly object to the minister grandstanding and moving well beyond the 5 minutes, 50 seconds, indeed, well beyond the Conservative member's time of 5 minutes, which sadly, Chair, gives him an opportunity to grandstand his clairvoyance that he wishes that he had or doesn't have or thinks he has, and totally inappropriate at this committee.
Thank you, Dr. Ellis. It seems there's a bit of grandstanding going on.
Point of order on a separate point of order, please.
A separate point of order.
Thank you, Mr. Chair. Since the Liberal Minister of Health a couple times tonight has thrown the Liberal Minister of Industry under the bus on the intellectual property side, I think it's incumbent upon this committee to urgently have the Minister of Industry before it to answer for the lack of IP ownership and the failure by his efforts to ensure that that was in by the minister's own standards. He's not responsible. Can you inform us when the can you inform us as part of the point of order? Can you inform us when the Minister of Industry will be here?
That's not a point of order. The Minister of Industry has been invited. We have not yet been successful in securing a date.